Hi, welcome to Health and Information. I'm Dr. James Bissland from Bissland Chiropractic, and we have a real fun show planned for you this month. We're going to be talking about treatment plans, how we come up with a treatment plan, the goals, how we plan our goals, and the importance of following through with the treatment plan on the first half of the program. The second half of the program, we're going to be talking about neuromuscular re-education. We're going to talk about spinal rehabilitation and the benefits that our patients are seeing from it and will continue to see from advances in neuromuscular re-education, both in the diagnostic and the treatment plan part of it, as well as the daily follow-through with the specific exercise protocols. You know, one of the things that is important for us as chiropractors is when we see a patient for the first time, we do the complete history, we talk to you, find out what's going on. In the consultation, we'll ask you a lot of questions. One of the most important things that we're going to ask is what it is you hope we can do for you, what are your healthcare goals, because when we write a treatment plan or when we develop a treatment plan, it's important for us to know what you want to accomplish so that we can help you accomplish your goals. And you're the boss. You get to decide whether this is what you want or what you don't want. I have a special guest with me today who is going to help us, and we're going to talk to a lot about goals, treatment plans, how we go about them. And I'd like to introduce all of you to my friend, Dr. Lana Pennell from Independence, Missouri. And Lana, welcome to the program.
Thank you.
Thank you so much for being with us.
Glad I can be here.
I want to do a little history for our audience. Lana and I have been friends since, well, many years?
Many years.
We were both children, let's put it that way. I like to joke a lot on the program that, you know, we started things when we were 3 or 4 years old, you know, just a few years ago. But as a matter of fact, this one is kind of true. We were both at least 10 or under when we first met. So
Right.
We've grown up together. We have gone to meetings together now as colleagues for probably 25 years or more. And one of the things that I got, her father, Dr. Lana Pennell, was our practice consultant and probably the #1 chiropractic consultant in the world, probably, wouldn't you say?
I would say.
Specifically when it came to dealing with the psychology of being successful. And that's one of the things that I've asked Dr. Lana to talk about today. And we're going to start talking about just the general thing of how are we successful in our treatment plans? How can you, as our patients or prospective patients, how can you help to accomplish things? So you sit at the foot of your dad for all the years when you were a child, when you went through chiropractic college. In your practice, he was right upstairs. Mm-hmm. So you pretty much got the idea of how it is that he talked to patients. And what would you say would be the #1 thing that he would tell a patient if he was here talking to a group of patients today?
Well, I think there's a couple of things that he would have said. First thing he would have said is that the success of the treatment plan is a team effort. It takes help from the doctors, help from the therapists, help from the patient to know exactly what needs to happen to help you get better. When we work with patient treatment plans, we always take into consideration what problems the patient is having, what types of problems they're having in their activities, what type of problems they're having at work, their pain levels, things like that, but also degenerative problems, history of injuries, and all of those things are taken into consideration to put a treatment plan together that's geared for that patient.
Okay, so the first thing that we look at, obviously, is what's wrong with them,
Right.
and can we help them?
Right.
So the second thing then, when you're writing a treatment plan, do you take the patient goals into consideration?
Absolutely.
So
I think everybody,
how does the patient communicate their goals? How do you recommend that they set their goals? I have a lot of patients who will say, well, I don't know what my goal should be.
Sure.
How do you answer that?
Well, I think you have to have short-term goals and you have to have long-term goals. If if I know that the end product is I want to be pain-free and I want to be able to do all my work without any problem, that's a long-term goal. But what are the first pieces that have to happen? For me, it's a matter of asking the question, what is it that you're hoping that we can do, like you said? If they're having problems with lifting things, if they're having pain levels that are severe, we want to address those things first as the short-term goals. And we have to be realistic. I don't think anybody could think we could just wave a magic wand and have everybody better in 2 or 3 visits. I wish we could, because I think that chiropractic kind of gets a tough rap there. It takes time for the body to heal, so we have to work within the realistic parameters of the body.
Now, when we talk about, you just said working together with the patient, it is a team effort, isn't it?
Yes, it is. Yes, it is. We need good communication from the patient. We need to know if they're having problems at home. We need to know if there are additional problems, maybe an illness or an injury that's happened in between visits. And all of those things we'll take into consideration as we continue the treatment plan.
I noticed that a lot of times when we are talking with a patient, their treatment plan goals are different than what maybe our treatment plan goals would be for them. And so, as you were just stating, the goals of the patient are important. The goals of the patient we need to take care of, and that's our #1 priority in our offices. One of the things that I have seen happen is that the goals tend to change as they go through treatment.
Sure.
We'll see people who their short-term goal is obviously get out of pain.
Sure.
And then as we're going to learn in the second half of our program today, we're developing more and more people that are saying, not only do I want to get rid of the pain, but I want to get the problem fixed. And I want to get the problem corrected. I want the balance. I want the biomechanical alignment fixed so that when I bend down to pick up the baby, or when I bend down to pick up the paper clip off the floor, that I'm not going to have it go back out again and come back into being the way it was when I started care the first time again. Now, one of the things that Dr. Lana Pennell often had said in many, many, many hours that we've sat through lectures in 25 years or more is that there was a lot of psychology involved. There was a lot of what we called head stuff. How much of that comes to play in your mind when you're sitting down with a patient for the first time in consultation?
I think head stuff is very important. If they're in a really negative mindset, then that could actually slow down their progress. If I'm in a negative mindset, that could slow down their progress. That's, I think, why we have such different goals. Their goal may be to be out of pain. My goal may be to do this or that or the other to get them out of pain. So we have to have good communication so that they understand what's going on. And then working with them to give them hope. A lot of people don't know that they can get better. They don't know what they can do to get better. And that's where we have to step in and give some direction and some assistance and some emotional support.
Well, you know, that brings up a good point that you said, because it's not just the frame of mind that the patient is in.
Right.
It's the frame of mind that us as the doctors are in, and just as importantly, all of our support staff.
Right. Our
front desk. When I talk to or when I interview either an intern, a medical assistant intern, or if I'm hiring a staff, or if I'm moving one from one area to the other, a lot of times we have to emphasize to them, remember, this may be just a job to you. This may be just, oh, you're putting the electric stim pads on the patient and turning the therapy up to where we told you to turn it up to. But to the patient, it's more than that. Because it's their health. It's their pain. It's personal to them. And one of the things that we always did is, and we always were taught to do, and that is you take every case personal.
Yes.
And I do. I take every patient that comes into my office very personal. I know you do. Dr. Lana and I have had the opportunity to be in each other's practice many, many times over the years. And it was one of the reasons why, when we knew she was coming down today to work on some projects, that we wanted to get her on with us, because we do think a lot alike.
Yes, we do.
So what are we looking at from the mental aspect? We talked about the mind frame of the patient. Do they need to believe in chiropractic?
I don't know, because it seems to work whether they believe or not. But I think that having a belief, or having a hope at least, that it's worked for somebody else and it might work for them, gives them that little boost that they need to keep trying. I've had some patients that come in and the first treatment they get some relief. And I've had other patients that maybe several treatments down the road before they see any relief, even though we know they're getting better. It just takes time for the body to catch on to what's going on and give the relief that they're looking for. So hope is a big thing, and having an upbeat attitude and helping them see that this is not forever.
There's a good point, the not forever.
Mm-hmm.
You know, we do health screenings at the Tulsa State Fair. We're going to be doing some at some of the malls throughout the city here. And one of the things that keeps coming up over and over and over again is, well, I love this, I heard. Mm-hmm. It's really kind of neat. But I heard that once you start coming to see you, I have to come see you forever. You've never heard that, though, up there.
I've heard that so many times. And I remember my dad speaking to that to some new doctors that had become clients years ago. And I had to laugh because he said, well, I don't know, do you see your dentist forever? And I thought, well, yes, at least for periodic checkups.
For maintenance,
and
yes.
He said that's exactly the same way with chiropractic. You know, we need the care when we need it, and then we need to maintain what we got. So going in for periodic checkups, tune-ups, if you will, sometimes maintenance care, sometimes supportive care, to help the body to hold on to the adjustments and maintain what they've worked so hard to get back. And that's important.
Because without that, we waste what we did to begin with.
Right.
Exactly.
Right. I don't want to retake the same treatments over and over.
No.
I want to take the treatment and maintain it as best I can.
And, you know, there are some deformities. There are some people who have weaknesses. Sure. That up until recently, some of the weaknesses we've had to be able to treat with supportive care because there wasn't anything else that we had available. And as I said earlier, on the second half of the show, we're going to show you and discuss with you the newer programs in our offices, which are the Neuro-Muscular Re-Education. And that is actually, we're starting to see some real improvement, not only in how people feel, but in how they stand up, how straight they are, how stable they feel on their feet. And we're going to talk a lot more about that in the second half of the program. As we move into our treatment plan, and we've looked at the mental, we've looked at the physical, now we got a plan together. We have to work together, and this is one thing that Dr. Lana had said a minute ago. And one of those things involves keeping appointments.
Right.
Because if you, as a patient, are on a treatment plan, that treatment plan was put together to help you achieve the goals that you want to achieve. Every time you miss an appointment, you slip back. And the research over the years has shown that it takes one treatment to catch up to where you were, and then an additional treatment to put you back to where you were before you missed. So
to keep moving ahead.
To keep moving ahead. So every time you miss an appointment, it takes two to make up for it.
Mm-hmm.
And so that can actually double not only the length of time of treatment, but the cost of treatment.
Right.
And one of our goals, again, in our offices is to provide the highest quality care at the lowest possible cost. And every time somebody misses an appointment, those two goals go down significantly unless we can catch them up and make them up. The other thing is that we do have to work together. Communication. I think communication, as in any relationship, whether it's a spousal relationship, a friendship, a doctor-patient relationship, anything, communication has to be there.
Mm-hmm. We can't help if we don't know there's a problem.
Absolutely. How many times have we heard that one?
If something new has happened, or I have some patients that were embarrassed to tell me I slipped and fell. And I said, oh my gosh, please don't ever be embarrassed for that. Just speak up so that we can check you over and see is there something else we need to address.
Exactly. we're going to be back in just a minute. We'll take a break for our commercials, and we'll be back to discuss the neuromuscular reeducation program that are new in both of our clinics, and hopefully give you some good insight to help you be able to look at those programs as something that might benefit you. We'll be right back after this message.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You want to talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected. We're Murray Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected. We're Murray Electric.
Over the past few weeks, when you come into the office, you've probably seen these exercise balls that are sitting around on the floor here in the clinic or in Dr. Lana's clinic. And we're going to talk to you a little bit about these, because a lot of people have asked, well, what are they for? What are you going to do with them? Oh, and the kids just love them, because they get to, and they wanted to go play with them. In fact,
Right.
we had several of our little children who come in and they just want to play with them. But these are serious rehabilitation tools. They look simple, but you know, again, I'm going to quote your dad, because one of the things your dad said, keep it simple.
Silly.
Yeah, there you go. Or stupid.
Or stupid.
Whichever.
Depends on the day.
Yeah, it depends. But it always was, you want to accomplish what you can accomplish the simplest, fastest, easiest way to do it. And over years, we've looked at rehab in my office, and I know you have, because we've been at the same meetings where they've presented them to us. And we've looked at rehabilitation, we've looked at spinal the rehab and the neuromuscular reeducation, the rehabilitation from multiple providers, multiple sources. And it finally came to be where, for me, I found the one that seems to work. And we put it in the office, and I want to talk to you a little bit about neuromuscular. And if you have something to add to what I say, please feel free to just pipe up and don't be shy.
Okay.
Not that you've ever been accused of that ever, yes. But you know, when we're looking at a person, we do the testing for neuromuscular, and we're looking for a weakness in the core muscles of the body, the pelvic muscles, the abdominal muscles, the back muscles. They have to be able to do certain exercises. These are called the functional testing. The neuromuscular has another component, and that is the proprioceptive or kinesthetic sense. And that is the feeling of stability, the feeling of I'm walking and I'm stable. I'm not going to fall. I'm not going to trip over my feet. I'm not going to trip up the stairs. Things like that. This is what we're looking for here. And I have several patients who have stated to me that following their neuromuscular treatment, that they're beginning to feel that stability come in, that flexibility of their body that they thought they'd lost. So many times we get to a point where we say, well, I know I'm not as flexible as I was when I was younger, but I'm just getting older.
Right.
That's no excuse, is it?
No, it's not just about the age. It's we start getting deconditioned if we're not still doing and going like we used to. And things weaken, so we need to strengthen them so that we can have that stability back.
And one of the things that we look at on the neuromuscular is there's a junction